I'm Dr. Pradeep Kocheeppan from Apollo Hospital, and I'll be talking about a third very common condition of people having the kneecaps, which is seen in this model as this kneecap which goes out of its place and then comes back. And this is called as patellar dislocation. It's a very common condition. And the problem is all patellar dislocations are different diseases. Why do people get it? Some of them get because of sports injuries. There's an accident, the ligament here which is called MPFL ruptures and the kneecap comes out. And then it goes back and then it heals there and the patient is normal. He may get one more time it going out only after 2 years or so, but that becomes a traumatic kind. But apart from traumatic kind, there are things where by birth this kneecap may be a little higher than where it should be, or this thing is called as the trochlea of the femur in which the kneecap sits. This trochlea may be fully shallow and this condition is called as trochlear dysplasia. The treatment for this particular disease has today become so standardized that we can treat each of the pathologies. If this trochlea is not having the depth, we can surgically produce a new trochlea, and this particular surgical technique is called trochleoplasty. It is a complex procedure, but with newer instrumentations and newer technologies, we are almost able to give them a good trochlea, and if these things are done on time, people may prevent a lifelong of disability. Today, because trochleoplasty is a complex procedure and it's available only in very few centers, and because of that people don't get an effective treatment for this technique. In this technique, it's an open surgery, but when we open, we try to produce back the trochlea back. It is as good as allowing the knee to be in its place and not come out of its place along with an MPFL reconstruction. If by birth the kneecap is high, we can bring the whole thing down, and this is called as tubercle transfer. Along with these three things, that is MPFL reconstruction, tubercle distalization and trochleoplasty, we will be able to manage more than 90% of all the cases by combining the various techniques to each other. Especially the trochleoplasty, which can be offered at Apollo and at an effective way of preventing an arthritis in this particular joint and a very disabling condition for young people who keep on getting the kneecap going out in spite of various surgeries being done and each of the surgery failing to achieve its goal.